Hi, Dr. Goodwin. This is Dr. Dieterich.
Hello, Dr. Dieterich. How are you today?
Okay.
Good. Are you also with Bob?
Yes, this is Bob Rice.
Right. Hello, Bob.
Hi, how are you?
Okay. Well, let's get started. More than 3 million Americans have a potentially fatal disease, and roughly half of them don't even know that they have it. We're talking about chronic hepatitis C, which is linked to cirrhosis of the liver cancer, and even death. Dr. Douglas Dieterich and former hepatitis C patient Bob Rice are joining us at Health Power today during Hepatitis Awareness Month to talk about the importance of getting tested for hepatitis C. Dr. Dieterich, why don't we start with you? What is chronic hepatitis C?
Well, I think you gave us a good introduction there. It's a viral infection that causes chronic hepatitis, which can lead to cirrhosis, liver cancer, which can result in liver transplant or death, actually, if you don't get a liver transplant, if you don't get treated, actually. I think that's the important part. So it can progress to all those terrible things if you don't get treated. I think the important point now to remember is there is treatment available, which is actually curative. We can actually cure this disease almost 99% of the time if we pick it up early enough.
I see. And how serious is chronic hepatitis C? I guess we talked about it with the cirrhosis and liver cancer and even the possibility of death. Is there anything else we need to?
No, I don't know what's more serious than death. That's pretty serious.
You're right about that. Now, how would someone know that they have hepatitis C?
Well, they have to get tested. I mean, that's why we're here with Gilead today. May is National Hepatitis Month. We want to make everybody aware that you have to get tested. You have to ask your doctor for the test. Don't assume that you've been tested just because you've had a blood test at the doctor's office. Doctors don't do that routinely unless you ask. So go ask your doctor next time you're in the office there to get a blood test for hepatitis C. And don't be afraid if it tests positive, because we can cure it.
Okay. Now, what would be the risk factors? What would make you think that maybe you should be tested?
Well, we're not even thinking much about risk factors. I'll tell you what they are. But the CDC recommends don't even discuss risk factors with the baby boomers. Just test every baby boomer born between 1945 and 1965. The other risk factors are having received blood or blood products before 1992, ever used IV drugs or intranasal drugs, tattoos, body piercing, even manicures, pedicures, boxing, and rugby, where there's blood-to-blood exchange, can transmit hepatitis C.
Okay, but you say all baby boomers should be tested.
Yes, and also, unfortunately, there's a new epidemic among under 30 group, part of that opioid epidemic that we've been hearing about,
Yes.
using IV heroin. That's also actually probably got as much hepatitis C as the baby boomers. So we're recommending, frankly, everybody be tested.
I see. Okay, that's good to know. Bob, tell us something about your experience with, I understand you've now had a transplantation, liver transplant, and you're doing well, but tell us a little about your experience.
Well, my experience, I was diagnosed in 1992 when Hep C came about, the testing for Hep C came about. Before that, there was no testing. I believe I contacted hepatitis C back in the 70s, the late 70s. So I lived for 15 years not knowing until I started getting some side effects, which, the side effects I had could be anything. I mean, I was fatigued, I had some muscle ache, and I just didn't understand why I was tired all the time. So I went to see my doctor, primary care doctor. He sent me to a gastrologist, and they did a Hep C test. They did also some liver enzyme testing, and they found out that I had hepatitis C. At that time, I had no idea what hepatitis C was. I don't think too many people really did. A short time later, I went on a treatment for hepatitis C that was available at that time. It didn't work. And over the next 10 or so years, I kept getting sicker and sicker, in and out of hospitals. Different things regarding liver disease kept coming up, and eventually in 2010, I had full-blown cirrhosis and ended up with a liver transplant. And I'm very lucky. Not too many people get liver transplants. And then again in 2014, 4 years after my transplant, I went back on the new medications today, which are a 99% cure rate, really, and I was cured of hepatitis C. And life is good today. Life is really good today.
Yes, well, that's very good to hear about that. And Dr. Dieterich, you would say now that hepatitis C does have a cure.
Absolutely. You know, we're here with Gilead today because it's May is National Hepatitis Month, Hepatitis Awareness Month, and we want to make people aware because we can cure this disease. There have been spectacular advances in the medical field. In the last 3 years, it's estimated that we've cured over 500,000 people in the U.S. of their hepatitis C and over 1 million worldwide with these new oral medications. Because as we said before, we're curing almost 99% of people now with a combination of medications that are all given orally. I mean, it's really a spectacular advance in medicine, and it's just done an amazing amount of good work. But you can't be cured unless you know you have it. So we want you to go out there and get tested. Ask your doctor to be tested, and don't be worried if you have it, because if you have it, we can almost always cure it.
Give me those baby boomer years again so we can share them.
Yeah, 1945 to 1965.
1945 to 1965. And also, more likely now with the opioid epidemic.
Right, with the under 30 group is at high risk with the opioid epidemic.
Okay, and how does one get more information about hepatitis C?
Well, I think the main key thing is you got to educate, and the best way to educate is there's a good website, hepchope.com. Go to hepchope.com, get educated, go to your doctor, ask to be tested for hepatitis C, and hopefully by going to hepchope.com, you'll have some information that you can ask your doctor to get some questions answered for yourself. And again, you get tested, you get tested, you find out you have it. Nothing to be afraid of today. You can get cured. The treatments are very easy today.
And the test is a blood test, basically?
Yes, it is.
Okay, so very good. Well, I'm very glad the three of us had a chance to talk about this and to share this information with the Health Power audience. And the website is hepchope.com, HEPCHOPE, hepchope.com. Correct?
Correct.
That's correct.
Okay, so thanks to both of you for sharing this information. I'm sure it will be helpful.
Thank you, Dr. Goodwin.
Thank you.
All right.